Sjögren's syndrome might sound rare and complicated, but it's something every person, especially women, should be aware of. Many people go undiagnosed for years, believing their symptoms are just dryness, aging, or stress. In truth, this autoimmune condition can be life-altering or even life-threatening when ignored. This guide is for patients, caregivers, and families. We'll break everything down in simple language to help you recognize the signs early and take action before serious complications arise too. What is Sjögren's syndrome? Sjögren's syndrome is an autoimmune disorder. In simple terms, your immune system, which is supposed to protect your body, mistakenly attacks the glands that produce moisture. The primary targets are salivary glands, mouth, lacrimal glands, eyes, other mucus-producing glands, nose, vagina, skin, and throat. But it doesn't stop there. In many patients, it spreads and causes inflammation in joints, lungs, kidneys, nerves, and more. 3. Who gets Sjögren's and why? While anyone can develop Sjögren's, it's most common in women over 40–90% of cases, people with a family history of autoimmune conditions, those already diagnosed with diseases like lupus, rheumatoid arthritis, or scleroderma. We don't know exactly why Sjögren's happens, but researchers believe a mix of genetics, hormones, and environmental triggers like viruses or stress play a role. 4. The two types, primary versus secondary. Primary Sjögren's, the disease occurs on its own. Secondary Sjögren's, it appears alongside another autoimmune disease, such as lupus or rheumatoid arthritis. Knowing which type you have helps doctors better manage symptoms and risks. 5. Common symptoms explained. A. Dry eyes, keratoconjunctivitis. Symptoms: burning, gritty sensation, redness or blurred vision. Feeling like something is always in your eye. Why it matters. Can lead to corneal damage or infection if untreated. B. Dry mouth, xerostomia. Symptoms: sticky, cotton-like feeling, difficulty chewing or swallowing. Bad breath, increased cavities. Why it matters. Saliva is essential for digestion and protecting teeth. Its absence leads to dental decay, oral thrush, and gum disease. C. Extreme fatigue. Symptoms: physical exhaustion, brain fog, depression-like symptoms. Why it matters. Fatigue is more than tiredness, it signals systemic inflammation and immune overactivity. D. Joint pain and stiffness. Symptoms: morning stiffness, pain in hands, knees, or ankles. Why it matters. Can mimic or overlap with rheumatoid arthritis, leading to joint damage if ignored. E. Skin, nose, and vaginal dryness. Symptoms: itchy or flaky skin, nosebleeds or cracked nostrils. Painful intercourse. Why it matters. These symptoms may seem minor but increase infection risk and discomfort. 6. Severe symptoms you must not ignore. There are signs that the disease is going beyond moisture glands and attacking major organs. A persistent dry cough or shortness of breath could signal lung involvement, interstitial lung disease. B. Swollen lymph nodes or glands, painful swelling near jaw or neck, may indicate infection or, rarely, cancer. See kidney symptoms: swelling in legs, high blood pressure, changes in urination. D. Nerve symptoms: neuropathy, numbness, burning sensations, muscle weakness. These require immediate evaluation by a healthcare provider. 7. Systemic complications, whole body involvement. Sjögren's doesn't always stay in one place. It can affect lungs, coughing, infections, and scarring, kidneys, interstitial nephritis or renal failure, liver inflammation or cirrhosis, blood vessels, vasculitis, a serious inflammation of the veins and arteries, nervous system, peripheral neuropathy or cognitive decline. These complications make early diagnosis and regular monitoring essential. 8. The risk of lymphoma. This is the most serious long-term risk. People with Sjögren's are up to 16 times more likely to develop non-Hodgkin's lymphoma, a type of blood cancer. Warning signs: swollen lymph nodes, fever, night sweats, unexplained weight loss, fatigue that worsens. If you notice these symptoms, see a doctor immediately. Regular blood tests and imaging may help detect it early. 9. How doctors diagnose Sjögren's. Diagnosis is based on symptoms, lab tests, and special exams. Blood tests: ENA, SSA-RO, SSB-LO antibodies. Eye exams: Schirmer test measures tear production. Salivary tests, lip biopsy or saliva flow rate. Imaging, ultrasound or MRI of salivary glands. A rheumatologist usually coordinates care. 10. Treatments and lifestyle management. There is no cure, but symptoms and complications can be managed with artificial tears and saliva substitutes, cholinergic medications like pilocarpine, anti-inflammatories or immunosuppressants, steroids for flares or organ inflammation, hydroxychloroquine Plaquenil for joint and fatigue issues. Doctors tailor treatment based on severity and which organs are affected. 11. Daily life with Sjögren's. Tips for managing daily symptoms. Use humidifiers at home, drink water throughout the day. Practice good oral hygiene, wear sunglasses outdoors. Take breaks during activities to rest. Staying consistent with your care plan is key. 12. Nutrition, hydration and self-care. What to eat. Anti-inflammatory foods, leafy greens, berries, fish, omega-3 sour flaxseed, walnuts. Avoid sugary or acidic foods that damage teeth. What to drink. Water is essential. Herbal teas, no caffeine. Avoid alcohol or caffeine, they dry you out. 13. Mental health and fatigue. Chronic illness takes a toll on mental health. Many people with Sjögren's experience depression, anxiety, isolation, brain fog. Strategies. Join support groups online or in person. Mindfulness and relaxation techniques, therapy or counseling. Speak openly with your care team. 14. What to ask your doctor. Bring these questions to appointments. Is this primary or secondary Sjögren's? What organs are affected? What medications can help? Should I see a specialist? How can I lower my risk of lymphoma? 15. When to go to the emergency room. Don't wait if you experience sudden chest pain or trouble breathing, high fever and chills, severe swelling or unexplained bruising, vision loss, inability to swallow. These could be signs of serious complications. 16. Real patient stories. Anna, 45. I thought I was just tired and dehydrated. I kept using eye drops and drinking water. It wasn't until I collapsed at work that they found my kidneys were involved. Lisa, 52. Sjögren's gave me brain fog so bad I couldn't finish sentences. My doctor said it was depression. I pushed for referral to a rheumatologist. That saved me. Their message: trust your instincts. Don't ignore symptoms. 17. Conclusion. Stay informed, stay safe. Sjögren's syndrome is more than dry eyes and mouth. It's a serious autoimmune disease that can affect your organs, your energy, and even your life. Early diagnosis and ongoing care can make all the difference. Learn the symptoms. Know the risks. Talk to your doctor. Share this knowledge, it could save a life.